So the first question is about research and synthesis questions. So are these two considered to be different?
No, I don't think so. I think, in fact, the research questions are addressed by a synthesis. So, in fact, when we're specifying at the level of a meta-analysis, for example, that really is the research question we're addressing. They are the questions. So, no, I don't see them as different at all.
Okay, thank you. And okay, what about when some of the answers to the INSCU questions will be based on data availability and therefore cannot be predetermined, sorry.
Yeah, look, I think there's a very kind of important discussion that continues to be had in the world of evidence synthesis as to the extent to which you can anticipate what you will find in your included studies. And I think, years back, someone said to me, Jeremy Grimshaw it was, perhaps you don't want to spend too much time specifying questions for which you'll never find a study or not find enough studies to do a synthesis. And I think there's a valid point in that. But equally, if you think about some of the work that's been done around logic models, and particularly for some of the more complex public health reviews, we know that we start off with important questions that matter to decision makers. And I think taking this approach really helps us keep our focus on what we want the review to address. There may be unknowns. One of the reasons for talking about the fact that we might need to modify some of our questions and comparisons really acknowledges the fact that there's some unknowns, and we're not likely to be able to anticipate everything we get in our evidence base. But I think what we would like to see is that reviews are driven by the questions that are deemed to be important by decision makers at the outset, not so much by what the evidence base ultimately looks like.
Yes, understand. Thank you so much.
I can already see the next question.
Okay. So yes, what is the added value of the INSCU tool versus a good prompt with AI? Is the tool free? Yes, that's an interesting one.
Yeah, I'm not sure when we were developing in Sync that we had actually thought about that per se. So it's becoming one of those things that everything we do is so much more needing to be influenced by AI. I actually think that AI can help us do some of the work, to be honest. I think if you think about, potential effect modifiers and subgroup analyses, sometimes we do very cursory work to come up with that. I have used, and I think we might be able to use AI to help us at least get a good steer on what we might consider in those analyses. Similarly, very recently for a review of exercise, not for osteoarthritis, I've been using it to come up with ideas about different ways of grouping the interventions. And I think AI can help us do some of that initial thinking work. I'm not sure whether AI yet would give you the checks and balances about whether you've done a good job with your specification of your synthesis questions, but I think it certainly can be helpful for the planning. I hope I'm not saying something outrageous in that. That's how I found it anyway.
Yes, exactly. And okay, thank you so much. And we have one more. So what is the role? So first, how important it is to plan the grouping of all of the PICO components?
I don't think that it's going to be equally important for every component in every review. In some reviews, there will be a level of, dare I say it, simplicity in the intervention. That means that it's not so complex to do the planning of that component, but the outcomes might be more complex, or there might be something about potential comparators that's more complex. So I think for individual PICO components, it depends on the review as to how important the planning is. What we think is most important is that in the final review, you are very clear about what questions you intended to address, and that helps the reader navigate your review. But it also gets rid of this concern that we've often had, for example, when we see very split meta-analyses, very specific outcomes, that in fact that was what the reviewer intended to do all along. They weren't just making decisions based on the data they had, and I think this is really important.